They are essentially going into the employer space, into the self-funded employer programs, and they're offering a suite of services around care delivery. And it's really interesting. It's a technology play, so they provide information, but it's also a connection play and an experience play in that not only do they wrap the technology around it, but they will connect you with care. They will follow up with care. And their financial model is very different from anything we've seen before. They are essentially going to baseline an employer's current costs for their program, and they are going to take a percentage of the savings over and above what they're able to save them. And because they understand healthcare so well, they are going to be able to do some things I think that are interesting to drive costs out of the equation. The redundant testing, the inefficiencies that just naturally exist in healthcare. And so Transcarent is interesting. They're going after that space that's a fairly lucrative space. So have you got a chance to take a look at Transcarent yet and what they're doing?
You know what, a little bit. That whole space fascinates me. I was actually having a conversation with my wife about this in preparation for this call. We were chatting about, her experiences recently in the healthcare system, and, how we all sort of it's always the gaps, right? The providers do a really good job here, the payers do a really good job here. But it's those gaps, it's the handoff, it's the patient experience, it's the consumer experience, I just had my annual physical yesterday, and I still, my cardiology report still isn't getting over to my primary care physician. So I would say they're doing a good job in attacking those gaps between all these places, between all these, whether it be the technology, the payers, the providers, everything. And I think that's where they're doing a really good job.